Good morning, guys, and I would like to make a video on little donor quality. I'm sure most of the people know about the transplantation success greatly depends on the donor quality and surgeons expertise skills. Here, why I'm making this video is there's something called a cheating donor. Of course, this kind of terminology is not there given in any medical textbook. It's for sake of understanding, I'm using this word and the kind of a cheating donor. A cheating donor means donor looks great for photos for naked eye, but when it comes to the surgery point of purpose, then when you examine and during the consultation or during the surgery, you would get to know this donor is really bad. You don't have any donor hair there. Such kind of a practical example I want to show. That's the reason I'm making this video. Kindly watch this video to understand why this kind of people who has a cheating donor would not get results. Okay, people they say I got a very good donor, but my transplantation did not go well. I didn't get any results. They would say, probably this is also a reason. Kindly watch the video to understand what kind of donors are available. What are the precautions that one should take for such kind of donors? Basically, this donor backside scalp donor, when you look at it, it looks great for such patients. Most of the time we say, yeah, my cousin underwent transplant, but he did not get any hair, but he had a very good donor, they say. And some people say, my long relative underwent transplant, he had a very less donor, but he had got complete hair back. I'm surprised, doctor, they say. This is because most of the times, probably this could be a reason. This kind of donors I would get to see once in 2-3 months. What is exactly is it looks great for the photos. Most of the patients will send the photos. When we see the photos on the backside of the scalp, looks really great. But when they come for a consultation, also we do check it. Different parameters are there. Basically, we check what is the donor area, the scalp size bigger or smaller. Number one criteria. Number two, we check what is the number of graft that is present in one given square centimeter. Number two. Number three, each graft has an average how many follicles, how many follicles, that's the number three. Last one, each follicle, what is the strength and diameter, I can say, the diameter. These are the four criteria I can make donor quality, and then we can decide donor is good, average, above, or best, whatever it is. If these four parameters are not meeting properly, we say donor is average. In this particular kind of a case, in this particular patient, donor looks great for the naked eye. That means when you sit from 3-4 feet distance and watch it, backside donor looks really great. Superb donor. When you examine it carefully, most of the doctors would miss this point. If you examine it very carefully, you will understand there's a lot of gaps. Okay, donor is not good. Then this kind of donor, if you do transplant, you will not get good quality grafts, and I'm sure this transplant would go to a toss. Here in this particular patient, the donor looks really great. You can see in video, and examining with a comb looks great. But if you observe very clearly from nearby, you can see a lot of gaps are there. But well, to understand better and more than this, I made few photographs and videos with the folliscope where you can see 3x, 4x magnification. If you can kindly observe this folliscope or magnified pictures, in a given square centimeter, you hardly find a graft with 3 follicles, triplets, hardly 3-4. That's so ridiculous. That means very less number. 60% of the rest of the grafts are singles. 60, even 70%. Those single graft follicular units also very weak. That means this is not a good donor for the transplantation. If you do transplant in this patient, I am sure donor looks great. Patient think that I got a good donor. Doctor also think this is a very good donor. But when you do take him for the surgery during the harvestation time, you end up in kind of there is no good donor. How many doctors has to have a guts to tell you that your donor is good after surgery? So that's the reason during the consultation we'll check this very clearly and inform the patient this kind of donor will happen once in a while. This is called a cheating donor. No one would know until unless the doctor examines it. Now, these kind of patients, what are the precautions that we're going to take? We need to Now implant these grafts because grafts are very less. We need to implant in a particular kind of important area to camouflage, and probably this kind of patient would need second or third session. That's the thing. We should not waste grafts unnecessarily implanting in the hairline area, forehead, temple area. We need to utilize for the only prime purpose like implanting in the frontal area and mid scalp to give a better camouflage. If not, if the plan is not good in these patients, probably you end up in a kind of a failure transplantation. And that's the reason. This point should never go miss during the consultation. That's the reason surgeon has to have a clear observation, clear examination of the patient before the surgery. So few precautions, few points to be noted before transplant would definitely bring them kind of a smile on their face with a little modification in the plan would definitely bring them smile on their face. They're really helpful for the patients. Thank you. Thanks for watching this video.